HPOA, hypertrophic osteoarthropathy, also known as Pierre-Marie syndrome. It is characterized by periosteal reaction of long bone without underlying bone lesion. Remember that there is no underlying bone lesion, but periosteal reaction is seen. Where is this seen? It is seen symmetrically in the appendicular skeleton involving the diaphysis and metaphysis of long bones. It is accompanied by soft tissue proliferation. Therefore, clubbing of fingers and toes will be seen. Study about the etiology. It is divided into primary or secondary. First, primary, it is due to hereditary reason, which is pachydermoperiosteitis. Secondary causes are lung causes, which is most common, which among is carcinoma. In carcinoma, non-small cell lung carcinoma, other lung tumors like lymphoma, bronchiectasis can be one of the cause of lung abscess or pleural malignancy. In CVS, we will have congenital heart disease. In GIT, inflammatory bowel disease. What are the clinical features seen? Mostly, it is asymptomatic. But you may remember in introduction, there is soft tissue swelling. So there will be clubbing, soft tissue swelling, and pain will be seen. What are the radiological features which is seen? It was periosteal reaction without bone involvement. So periosteitis will be seen, which will be initially smooth, but later it would be multiple. And it involves diaphysis and metaphysis of long bones, and later epiphysis will be involved. In joints, sometimes effusion can also be seen. As you know, soft tissue swelling is also seen, and in the digits, clubbing would be seen, which would appear radiologically as bulbous enlargement of finger and toes. Now let us see the X-ray. What you can see, this is the wrist X-ray. Here this red line, these are periosteal reaction, which is appearing hyper. On your right, the circle part, this is normal, where you don't see this. I'll erase it. See this hyper line. These are periosteal reaction due to periosteitis, which is appearing hyper outside the cortex of the bone. This is periosteitis, which you can compare it with the normal also. Therefore, when you look at the wrist X-ray, you shouldn't focus only on the carpal bones. You should look below it to see for periosteitis. If periosteitis seen, then HPOA, hypertrophic pulmonary or hypertrophic osteoarthropathy, should be considered. So you can see that white arrow mark is showing the periosteitis, therefore periosteal reaction, which is appearing opaque or which appears white outside the cortex of the bone due to periosteitis. It can be initially smooth or it can be multiple. What are the CT features? You have to look for intrathoracic pathology because lung was also the cause, the malignancy, non-small cell carcinoma. MRI, look for soft tissue changes, periosteitis, which will appear as increased signal intensity on T2 and STIR. And in nuclear medicine, technetium 99 MDP bone scan will show increased uptake. What will be the treatment? Treatment is to remove the primary cause and symptomatic treatment like NSAIDs for the pain and steroids. The differential diagnosis you have to remember, it can be varicose veins, the thyroid arthropathy and dish.